Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know, I believe that we are stronger together. So without further ado, let's get started. Welcome back. Thanks so much for joining us. Today I have another amazing PA I want to introduce you to, and he practices tele-ICU. Let me introduce you to him. Hi, David. How are you?
Hi there, nice to meet you.
Nice to meet you as well. Thank you so much for joining us. David, can you start off by stating your name, how long you've been a PA for, the area of medicine you practice in, and how you utilize telemedicine in this specialty, please?
My name's David Rossi. Been a physician assistant for 21 years now. Graduated from Damon College up in Buffalo, New York. Sort of started in emergency medicine, and as an emergency medicine PA, I was always wondering, geez, what happens to my patients when they go up to the floor? So then I got a job as a hospitalist PA, did nighttime hospitalist work for about 12 years, which was wonderful. But then as a hospice PA, wondered, geez, what happens to my patients when they go to the ICU? So luckily got a great job at a university hospital in one of their surgical intensive care units where I was able to round with, wonderful attendings and fellows and residents. Just a great learning environment. And that transition to where I'm at now. I was looking to move from New York. New York's wonderful, but wanted to get away from the snow. And we wanted to move to Florida. My wife's a nurse, so we sort of collectively found jobs in the same healthcare system down here in Florida. And I got very lucky to have a virtual ICU position.
That sounds amazing. Can you share with us a little bit more about how this tele-ICU works and what exactly you do?
Okay. So briefly, I have a split position where I do half the month at the bedside in one of my system's actual ICUs, which is great. I get to keep my hands-on skills. But the other half of the month, I work in a virtual ICU. The virtual ICU is a command center that covers my health system. My health system has 12 hospitals and encompasses 18 different ICUs. At my command center, we have three providers, usually one or two docs and APP like myself, critical care nurses, critical care techs, and a clinical pharmacist. So we sort of throughout the night from 7 p.m. to 7 a.m. take care of the systems within or the ICUs within my system that don't have intensivists on site. Only three of the hospitals actually have intensivist APPs on site. The rest of them are all old school. The nurses would have had to call the doc at home. Now they have us, and it's really changed things for the system.
That's amazing. So, can you tell us a little bit more about this command center? Kind of give us an idea of how the layout looks and what are you able to see and what your command center actually looks like.
Okay, so our center has each provider, each nurse, each tech has a station where you have a keyboard. I have six screens, so I can pop different things up. I'll have one of the screens will have my telemetry. My one in the middle will have all the charts. So I can click on any patient at any moment, see their vitals, see their labs, read their histories, everything. And then one of the screens is dedicated for the camera. So what will happen, our role throughout the night is, we have a few different roles. The first thing is to review all admissions. So any patient that comes from the emergency department or maybe from a rapid response from the floor, once they come in, it's our job to review things. Review meaning go over the chart, look at the labs, and then I'll go in and camera in on the patients. We have a camera that I can see very, very well onto the patient. I can see the drips. I can see what their ventilator settings are, review everything, and then sort of talk to the nurse and say, hey, okay, this is the plan for the evening. This is what we're going to do. What do you need from us? And we just sort of collaborate back and forth. So each person in the command center has that desk. The nurse does, the techs do. We have wonderful clinical pharmacists who are there all the time if I need anything as far as what's the latest study on this drug and COVID and blah, blah, blah. So it's a very collaborative, awesome place to work.
Thanks so much for sharing that. Can you tell us what it is that you like about telemedicine and what you find to be a challenge, please?
Okay. Well, what I personally like, once again, is this collaborative thing we have at night. I've been a bedside provider at night where my supervising doc isn't around, or I don't have a backup, especially at night. I've done that for years. So when I'm a bedside PA and I'm there at night, for me, be able to like each ICU room has a little blue button. Okay, for me to be able to press that button, and within a minute, my attending doc can pop up on a TV screen, and I could be at the bedside, be like, hey, this person's blood pressure is 40. I've got them on 4 pressors. What do you think? To have that person right there is so reassuring. And that's what we offer to the nurses and to our patients. I mean, think about before this, when you'd have a patient at night who was crashing, and the nurse is calling an answering service, waiting for someone to call back. That could be 15, 20 minutes where this patient is not perfusing well, is circling the drain. Now we can camera right in and take care of that patient right then and there. And that's very reassuring for the provider like me or the nurse that's there. Sometimes, as I said, some of these places, they don't have, there's no one there at night to do procedures. So it also might involve me calling the doc at home saying, hey, this person needs a chest tube, this person needs a line. Or I might have to call the emergency department physician if someone needs to be intubated. So there's things we help to reach out for the nurse who's at the bedside who maybe can't do that. So we can reach out to do a lot of things, and having that camera there is very reassuring for the person at the bedside.
Absolutely. It sounds like, like you were saying before, we used to just pick up the phone and call, and that was normal. We'd call the answering service, or the nurse would call the answering service, and then it would follow the chain of command of how to get to the right person. But now, literally with audio visual, you're able to see more, do more, and properly assess, and then give the appropriate recommendations.
Yes. You're a little limited. I know you mentioned what's the downside. So obviously, you're a little limited as far as what you can do from a physical exam, obviously. So if I need to palpate someone's abdomen, I'll camera it on the abdomen. I'll have the nurse do it, or we do the best we can. If someone wants me to look at someone's cellulitis or something like that, I can see things, but it's obviously not the same. So you're limited like that. But the system we have, like I mentioned earlier, we can see right down to someone's arm band. You can see the little details, so you can really see quite a bit. With COVID, it's been a little limited because you're talking to people who have masks and everything else on, so it's hard to hear sometimes. But other than that, it's what we can do over the screen is really amazing.
And I expect that only to improve as technology advances and we have new things that we're able to use and utilize.
Yes.
All right, David, can you share with us a clinical pearl, a word of wisdom, something with our PA students and fellow PAs who may be watching this, please?
So much to say. I don't know. I guess what I recognize as someone who's been doing this for 21 years is I am still always super excited about what I do. Like, I think being a PA is just it's just a great profession. You can do so many things, and you can touch people in so many different ways. It's a wonderful profession. So never sort of forget that. Like I remember when I was a student, and you're spending all these hours in the library, and it's your whole life for that 4, 6, whatever years it is at that time. Always sort of remember all that work you had to do to get there. Because there's going to be times, 10 years into your career, like, oh my gosh, such a hard day, blah, blah, blah. But always be thankful for where you're at and remember how hard it was to get there. So I guess I'd say that. And the other thing is just keep your empathy, like, especially sometimes, especially if you're in critical care where maybe you don't get the interaction to talk to your patients, you can get wrapped up in, ventilator settings and lab values, and sometimes you maybe forget that that's a person there, and when you walk in a room and maybe you'll see a person's picture or something like that, you got to keep focused that that's a person, and don't just focus on the numbers, focus on the fact that they're a person. And when you're burnt out with COVID and everything else right now, just remember that we're here to help these people, and don't let that burnout affect the way that you practice. Keep your empathy.
Excellent words of advice. Thank you so much, David, for joining us. And thank you, everyone, for tuning in. Until next time, we'll connect with you soon. Take care, everyone. Bye.